Korea's doctors remain opposed to the government's plan to boost medical school seats starting in the academic year of 2025, with doctors in training engaged in a prolonged walkout that began in late February. So what is the government's broader healthcare reform plan? Why are doctors opposed to raising the medical school admissions quota? And what are the potential legal consequences for the medical sector amid a prolonged walkout? Welcome to Thursday's edition of Issues and Insiders. I'm Min Sun-hee. Today, we touch upon the ongoing conflict between government authorities and doctors in the country over the foremost expansion of medical school admissions quota starting next year. For details on the dispute thus far, I have our Kwon Soa here in the studio. Soa, welcome back.
Good afternoon, Sunny.
Right, so Soa, let's begin with details then about the government's healthcare reform plan.
Well, what most people who have been following this issue are aware of is the conflict between the government and the medical community over the government's planned increase of medical school admissions. But there is a little bit more regarding the reform. So why don't we take a closer look at the Health Ministry's 2024 Action Plan for Key Policies under the vision Healthcare Reform and Welfare for the Week to Open Up the Future, which it announced back in March this year. Now, 4 core tasks are part of the reform. The first one, healthcare reform to save lives and local communities. So this is the one focusing on increasing the country's medical workforce. And then we have welfare for the week 2.0, which aims to actively use information and communication technologies, as well as artificial intelligence, to identify vulnerable groups and help them. Third, the government plans to increase patient care to reduce the burden on families, and not only care, but the financial burden is to be reduced. The last key mission is about securing healthcare and welfare reforms for future growth engines, which will include support for childbirth and childcare. Let's go a little into the details of the first task, which we could say is the core task under which the Yoon Suk-yeol administration originally planned to expand the medical school admissions quota by 2,000 starting next year. It also aims to deal with the shortage of doctors, particularly in rural areas, and to encourage more physicians to work in essential medical fields. Providing a safety net for doctors and patients in the occurrence of medical accidents is also part of the plan.
Right. Now, speaking about the shortage in the medical doctors, science that is, the plan to expand medical school seats has been met with fierce resistance from doctors in training especially. What has been their stance, Soa, and the related action, of course?
Right. Protests started some 4 months ago. So since late February, some 12,000 trainee doctors, which is around 93% of them, have been on a strike against the government's medical school admissions quota hike. Medical students across the nation have been boycotting classes. Community doctors and medical professors have also shown their support to the collective action in various ways. Professors at teaching hospitals have taken days off midweek and also discussed indefinite walkouts. We'll get into that in more detail later on. And a one-day strike led by the nation's biggest coalition of doctors, the Korea Medical Association, was also staged last week, with over 12,000 doctors having gathered in Western Seoul. Community doctors joined as well. Now, the junior doctors and the medical community that supports them have consistently rejected the government's plan of increasing med students, claiming it will lead to a collapse in the healthcare system as schools won't be able to handle the sudden increase, which would eventually take a toll on the quality of medical services, they say. Their argument against the government's aim to increase doctors in essential fields, meanwhile, is that the more medical students are recruited, they would tend to work in high-paying fields like plastic surgery and dermatology anyways. So with that, the doctors' groups have been urging to start medical reform negotiations from square zero.
Right. And so what has been the public response thus far to the prolonged standoff between the government and the medical arena?
I think it was a little more difficult to have a clear stance on this some months ago when this started. But if we refer to recent opinion polls, it appears like the majority of the public supports the government side, or they are against the doctors' walkout. So let's take a look at responses made by 1,032 adults made between June 12th and 13th on a survey regarding the ongoing medical standoff. More than 77% disagreed to the protests, mainly out of reasons the situation violates citizens' right for health. Less than 15% agreed with the doctors, saying it's their right as professionals to make their demands, and around 8% were not sure. When asked about the reasons for why the medical community seems to be on strike, the number one response at close to 64% was that they are doing it to protect their vested interests. Around 20% replied the doctors are protesting against the government's unilateral decision-making. 8% believed it's to improve the healthcare system, followed by some 4% who thought the main reason is to prevent poor quality education at med schools. The public sentiment has a lot to do with people personally having been affected by the walkout, as 6 out of 10 respondents said they themselves or family members have experienced difficulties due to the medical vacuum, including in making appointments and also delays in treatment, and some even experienced delays in receiving emergency treatment, although that was a minority.
Right, I see. Meanwhile, up next, for some legal perspective on the prolonged standoff between government officials and medical practitioners over the former's healthcare reform initiatives, I have Professor Kwon Soa at Chungnam National University live on the line. Professor Kwon, it's a pleasure to have you with us.
Thanks for having me.
Right, Professor, generally speaking then, what are the legal consequences of failing to abide by a government's return to work order?
Okay, Article 59 of the Medical Service Act states that the Minister of Health and Welfare may render a necessary instruction and order to doctors and hospitals if a severe level of hazard to public health has occurred or there is a risk for such. Also, the minister may order doctors and hospitals to resume operations if they unjustifiably discontinue treatment or collectively suspend or close operations, causing or likely to cause significant disruption to patient care. And the hospitals and doctors cannot refuse such an order without a justifiable reason. And there was a Supreme Court case which held that the administrative agency should be given a lot of discretion as to the determination of whether the conditions for instruction and orders are met, and if they are, what type and content of instruction and orders the administrative agency can issue. And Article 88 of the same law states that the penalty for violating Article 59 is up to 3 years in imprisonment or 30 million won in fine, and also suspension of license is possible. On the other hand, the return to work order can be considered as forced labor against the doctor's free will, so that it can be in violation of Article 12 of the Constitution, which says that punishment or forced labor should not be imposed unless it is in accordance with law and due process. Also, return to work order can be in violation of Article 7 of Labor Standard Law, which says that employer may not compel labor against the free will of the employees through intimidation or other means that unjustly restrict mental or physical freedom. But given the court recently held that public interest in ordering doctors to resume work to be much higher under Article 36 of the Constitution, that is, all citizens are entitled to protection of their health by the government. The provisions of the Medical Service Act granting discretion to the administrative agency and authority can be deemed constitutional. But at the end of the day, there has been no case so far where doctors were punished for refusing to comply with a return to work order.
Right. Professor Kwon, against that backdrop, doctors in training here in the country have been on a strike since late February. What are the potential legal repercussions that they are likely to face given their prolonged walkout?
Okay. Whether the strike and collective resignation by residents constitute a violation of Medical Service Act will depend upon whether it can be considered a justifiable reason under Article 15 of the same act, which is doctors and hospitals must not refuse medical treatment or midwifery request without a justifiable reason. That is because collective leave or group resignation can be interpreted as a refusal to treat. On the other hand, it is also possible to argue that resigning voluntarily by the doctors should not be considered as a refusal to treat. And concerning possibility of other type of penalties, proving a causal link between a strike and medical malpractice could lead to charges of manslaughter or injury due to negligence in criminal action and compensation for damages in civil action. But it's going to be difficult to prove such causality due to the absence of residents because there are full-time fellow doctors and medical professors present in hospitals. And since the group has submitted resignation letters and once they are processed, it may result in a situation where it is legally difficult to punish them other than that they become general practitioners without qualifying as a specialist.
I see. Moving forward then, Professor Kwon, there has been talk about the possible introduction of foreign licensed doctors here in Korea. What legal revisions are perhaps necessary to allow for this introduction?
Okay, currently foreign licensed doctors must pass the Korean national exam to receive a medical license here. But there are exceptional cases where medical practice by foreign doctors can be permitted. Article 18 of the enforcement rule of the Medical Service Act states that the minister may permit individuals who hold a foreign license and reside in Korea to perform any of the following medical tasks. First, duties of exchange professors due to educational cooperation with foreign countries. Second, duties for educational research project. Third, medical volunteer work of international medical volunteer groups. But those three provisions is not going to be applicable here. So the ministry is now attempting to add a new provision which says medical support duties by foreign doctors deemed necessary by the minister to protect patients' health in the event of a crisis alert of a severe stage issued under the Disaster and Safety Management Act. For this new provision, there has been public notice of amendment of the regulation, but the minister can use this regulation only if there's a crisis alert of severe stage in medical services. So this is only an emergency and temporary measure.
Right, I see. Professor Kwon, before I let you go, one final question, which essentially is the million-dollar question. Do you believe the current standoff between the government and medical practitioners will persist? I mean, how do you see this case unfolding?
Okay, unless the government comes up with some kind of exit strategy, the standoff can continue, unfortunately. The increase in medical school admissions has already been announced in admission guidelines. And with acceptance of application for rolling admission, which is sushi, starting in early September, it has become difficult to reverse the 50% increase. Also, if the issue of medical students' collective leave of absence and mass failing, U-group, is not resolved, a major problem will arise next year, as medical schools will have to educate 2 to 3 times more students, combining those who have failed this year and the increased number of new students next year. And with the start of second semester, the situation is expected to worsen with either mass failing or collective leave of absence. Moreover, with a collective resignation by the residents, university hospitals may be forced into a situation where they must recruit new residents. But if and when medical students return to class before the beginning of the second semester, there is a possibility of avoiding mass failing because, according to medical schools, the academic year, medical school, can be done within 6 months. So one last comment that I want to make is that I hope that this standoff is not going to be resolved by the judiciary. Rather, I do hope that this standoff be resolved by reaching a compromise between the government and the related parties in medical field.
Right, of course, indeed, a compromise between the government itself and the medical arena. All right, Professor Kwon, thank you so much for your time and your thoughts on the standoff.
My pleasure.
Right. Meanwhile, back here in the studio, Soa, I understand concerns of a potential larger collective action by the medical sector was eased when medical professors of Seoul National University called off their strike, right?
Right, Sunny. Seoul National University Hospital, one of Korea's big 5 hospitals, and the first that had actually initiated an indefinite walkout by its medical professors on June 17th, decided to end its strike last Friday. Now, the professors said they could no longer put patients' health at risk. With that, the hospitals and 2 other SNU-affiliated hospitals resumed medical practices. Other professors at leading hospitals quickly followed suit earlier this week, including those at 3 hospitals affiliated with Samsung Medical Center and 8 with the Catholic University of Korea. Asan Medical Center reportedly was closely monitoring the situation of other hospitals. Meanwhile, the Korea Medical Association also canceled its earlier announcement to begin an indefinite walkout this Thursday, which would be today, which was a decision criticized to have been a unilateral move by KMA head hardliner Im Hyun-taek and is instead set to discuss their next steps at a committee meeting this Saturday. And a special committee, in fact, was recently established under the wing of the KMA, encompassing representatives of medical professors, trainee doctors, regional medical groups, and medical students. So while these latest developments may appear to raise hopes for some ease in the conflict, major hospitals of Yonsei University on Wednesday said they will push ahead with their indefinite walkout starting today, Thursday. They were said to have begun to suspend treatment of outpatients and non-emergency surgeries at Severance Hospital, Gangnam Severance Hospital, and Yongin Severance Hospital. Also, I want to mention the Emergency Committee of Medical Professors at the Catholic University, at which some 70% voted in favor of halting the walkout. More than 80% were also for a new round of strike if necessary in the future, so many uncertainties remain.
Right. So, by the way, what's been finalized about the size of medical school seats for next year?
Yes, the medical school quota for 2025 has been finalized exactly a month ago. The Korean Council for University Education approved the allocation of 4,567 new students next year at 40 medical schools nationwide. That's 1,509 additional seats from the current quota of 3,058. Although it's not yet the 2,000 extra slots the government is aiming for, it is an almost 50% increase. Based on the government's calculations, an annual increase by 2,000 starting next year for 5 years would make up for the predicted lack of some 10,000 doctors by 2035 amid Korea's fast-aging population. According to officials, Korea has an average of 2.1 active physicians per 1,000 people. The average among the OECD or developed countries is 3.7. An association of patients, meanwhile, said earlier this week the government and doctors should stop wasteful arguments, especially regarding the 2025 quota that has been finalized already last month, and should rather start discussions for admissions the year after 2026.
Right, I see. Also, so I understand there's been a bit of foreign media coverage about the need from more doctors here in the country, right?
Right. I mean, local headlines regarding the prolonged standoff have been making it into foreign media because it's not only Korea that is dealing with such issues regarding medical reform. There have been similar conflicts in the US, UK, Kenya, and China as well. Now, let's look at an article by The Diplomat that was titled "South Korea's Healthcare Sector is Heading Toward a Crisis." It introduced not only the current protest situation and unfortunate happenings that affected patients since the standoff, but also provided some background on the shortage of doctors in the past years by giving examples of cases where patients in ambulances had to be turned away by hospitals due to the lack of relevant medical staff. It also mentioned Korean physicians' average earnings, which roughly is twice as much as the average of OECD members, and how those getting offered positions in remote areas get paid much more. Now, the New York Times had an angle that focused on Koreans being frustrated about the doctors' standoff and blaming the president for not being able to negotiate with the doctors as the walkout has been dragging on for months. The report also noted how Korea has long taken pride in its healthcare system, but the doctors, especially those working in emergency, are overwhelmed. Long working hours and low pay has been mentioned here, and that was interesting. The other article I mentioned by The Diplomat mentioned the big earnings, but also here the New York Times mentioned the low earnings depending on which field you're working for, saying that dermatology, for instance, makes more money despite not being an essential medical area.
Right, I see. All right, so thank you for that coverage. We'll see you next time then.
Thank you, Sunny.
Well, the standoff between government officials and medical practitioners is raising much concern about the fate of patients in need of crucial care. Accordingly, calls are growing for more efforts to bridge the gap over differences. Thank you for watching.